Welcome to the Prescription for Primary Care podcast. I'm Rebecca Ramdahal, your host for today's episode. I'm a digital marketing specialist for Healthy On, and we are helping to revolutionize primary healthcare in Canada. Today, I'm very excited to be joined by Portia Mielnik. She's a physician assistant with experience in the primary care setting. Portia, thank you for joining us.
Yeah, thanks for having me.
Awesome. I had sent you a link to an article. So in late July, the Hospital News published an article spotlighting Ontario physician assistants as a solution to Ontario's primary care crisis. So before we start, can you tell us or explain what physician assistants do and your role in the healthcare team?
Yeah, so physician assistants are highly trained medical professionals who work with physicians as well as allied health. And our goal is just like any other healthcare provider, we want to provide you with excellent care. So part of my role in family medicine is I conduct histories, physical exams. I will come up with my list of differential diagnosis, which I think might explain likely what's going on. I determine whether there are investigations that need to be ordered, like labs or images. I then come up with an assessment and plan. So this could include something as simple as just giving advice to reassure somebody that, for example, a skin lesion that they came in with, it's not cancerous, we don't need to do anything. So it could be something as simple as that to prescribing a medication to making a referral to a specialist. So it's very variable. Since physician assistants are trained as generalists, that means we come out of school with a varying scope, and then that scope kind of gets defined based on the supervising physician or physicians that they work under. So where I work, I used to work under 7 different physicians. So I would have some that had additional skills in gender affirming care, addictions, obstetrics, you name it. So as a result, I have quite a pretty broad focus. And if there's something that I'm really interested in, like minor procedures, I get the opportunity to do that.
Wow. Okay. So, depending on the physician that you're assisting, you can actually, you know, try different things. Basically, that because you mentioned addiction and gender affirming care, and that's like a wide scope.
Yeah, my
So,
scope has changed quite a bit. From when I graduated, my first job was in primary care as well.
mhm.
In that position, not only did primary care, but he had an interest in addiction medicine and cannabis. And at the time, that was pretty unique because cannabis had just become legal in Canada. So I was one of the very few PAs that was actually counseling and educating patients on that. Then my role changed. I did 2 years of working in otolaryngology, so ear, nose, throat specialty. Then I did emerge medicine. I've done urgent care, and I worked in Nunavut in occupational medicine for a month before I returned to primary care where I currently am. So I have had quite a variety of experiences as a PA, which has really helped me in my current job.
Wow. Yeah, like before this, when I thought of a physician assistant, I thought of a very kind of one kind of assistant, so just for that, traditional family doctor. I didn't know that you could kind of, bounce between different kinds of physicians, and then you kind of change your role depending on the physician. That's actually pretty interesting. Um, so it's what's also interesting is the article mentioned that PAs have been working in the primary care medicine setting in the US for almost 60 years. And in Canada, it's pretty new. It was first integrated into the Canadian Armed Forces in the 1980s. And then PAs weren't integrated into the civilian Canadian healthcare system until very recently, which like Manitoba in 1999, in Ontario 2007, and then just 2023 in BC, Newfoundland, and Labrador, and Prince Edward Island. That's crazy. It's taken that long to recognize like how much value you bring to the healthcare sector. So what does that mean? Like we're Canadians are waking up to PAs. Why have we not heard of you guys before?
It's funny, like when I've done conferences in the US, when I get into a cab and they ask me what I do for a living, when I say I'm a PA, it's like, it's like when somebody were to know that you're a dentist or a nurse practitioner, I get so much recognition. But in Canada, I would say it's a pretty common response. Nobody knows what I am. I like to think of myself as like the amoeba, and in healthcare, because our role isn't as well defined, I think, which is great. It gives us so much advantages. Like I said, it's really helped me with such a broad scope, and I can narrow it down as much as I like to. So why is it taking Canada so long?
Yeah, that's
We don't
crazy.
have a good answer, but I
Yeah.
mean, it takes years for change. It's taken years for nurse practitioners to get the rights
Hmm.
and the things that they do now. So, I mean, it's coming even in the last year. It's so exciting. I graduated in 2018, and at that time, I was quite scared as a new grad because what we were waiting for was government funding.
Hmm.
So I remember our graduating class, we just kept waiting for this funding money, which ultimately was going to help some of us get our first jobs. And I remember thinking, oh my gosh, if this doesn't come out, I just wasted, in my head, like 2 years of schooling for no job opportunities. Luckily, that was not the case.
Hmm.
And my first job was through the Career Start Grant. So that really helped out a lot. And then the last year has been so exciting with regulation. We're under the CPSO now, and just in, I believe it's last year and a half, we have additional training programs all throughout Canada. So when I first applied in Ontario, you can only apply to Toronto or McMaster, and I went to the University of Toronto. But now there's programs in Halifax, Winnipeg, Calgary, Saskatoon. So this is super exciting. Even when I first applied, I think there were only 23 of us per class, and I was quickly just looking it up now that they've expanded that to now accepting 40 students, 48 students. Other programs are just 15, and it's all based on government funding. So
Hmm.
this is all very exciting. This just means that we're finally getting the recognition. We're being seen as helpful providers that can be a solution
Hmm.
to our healthcare crisis.
So, um, when you went to school, so did you go to school like on the medical route, like to become a doctor, or is there some kind of deviation around there?
Yeah, so I mean, originally when my first undergrad was at the University of Waterloo. I didn't even know what a PA was. I
Hmm.
only thought you could be a nurse or a doctor. And
Hmm.
then I can't remember. I think it was one of my career advisor appointments. They said, "Well, what about a PA?" And I had no idea what it was. And at the time, the definition really didn't make sense to me. All I knew was when I graduated, I was going to get to work with patients. And the way they explained it to me, it just kind of caught my eye. So, I mean, the University of Toronto, it's in the medical faculty,
Hmm.
um, but it's not like I can use my degree to become a physician. I would still have to write the MCAT, depending on the school I apply to. I'd still have to do the residency, like I would have to start from scratch essentially.
Okay, yeah, that's
Yeah.
what I was wondering. So you're doing a lot of medical, but you're not necessarily, you didn't do the residency. You're not spending all like another 10 years in medical school. Um, but you're helping doctors and you're pretty much doing what you want to do other than like surgery, maybe. So yeah, PAs don't necessarily do surgery. I mean, I would assume.
Yeah, so it really depends on what you call a surgery, right? Like, I mean, we can
Mhm.
assist in the OR. There are many PAs that are first assist. It really just depends on their comfort level. Are they doing like a solo appendectomy? No, probably not. But we still do a lot of minor procedures. And I have heard of some military trained PAs up north that, again, because of their training and their comfort in the field, that their supervising physicians are okay with them being involved in. So it's so
Yeah.
variable. It
So it
depends on the
depends on,
trust. It's
yeah,
ultimately a relationship between you and your supervising physician.
right. Um, So so obviously, Ontario is facing a primary care crisis. We don't have doctors, especially in the underserved communities. So have you seen this in your workplace? The shortage, is it impacting the patient care in your experience?
Well, I think the first thing is like underserviced communities, right? I think we always misinterpret. We think it's always Northern Ontarians or our Indigenous populations, but I've seen it happen in little towns like, Stratford. Like when I was a student, I was to train under a family doctor in Stratford about 2 days before I was supposed to start my rotation. Unfortunately, I'd learned that he had suffered from a pretty critical healthcare condition, which ultimately led to him closing his practice. So this led his patient rostering, which I don't know the exact numbers, but let's say for easy numbers, 300 patients instantly without a family doctor.
Yeah.
And so luckily he was part of a family healthcare team. And so a lot of the doctors did try to take on an additional 5 or 10 patients, but out of those 300, there were many that were basically back into the community. And now we're having to either go to a walk-in clinic or to an urgent care or an emerge setting to get the care that they needed. So, yeah, I think we think of like, oh, it's got to be like really remote places, but it can happen in,
Yeah. Even in inner cities. So like doctors are aging out and no one wants to do family practice. So you end up having all these unattached patients with no doctors, and now they're scrambling to find someone. So if you say you have a doctor who's aging out and it's just you have too many patients, like PAs can help with that, right? With the workload, I mean.
So we can never, be solely responsible for a clinic without a supervising physician. So essentially, like if a doctor did need to retire or chose for whatever reason to end early, they would need to hire on another physician for that. But I mean, in terms of what we can do, I mean, one of the biggest concerns with primary care is the amount of paperwork, the burden of that, and it's people think that you just show up to the office, you see your patients, and you get to go home. Well, there's inbox, which essentially means anything and everything that you order needs to be followed up. It needs to be reviewed by someone. So that's one of my roles that I do on a daily basis. And when a physician's on vacation, well, then that gets assigned to somebody. So that's something I can easily go into. So I review every investigation that comes in. I'll either update the chart appropriately, I'll recall the patient if I need to review the lab and discuss a further plan. I'll forward the result to the appropriate specialist, whatever needs to be done. So that's one way that I can offload. And then not just that form of paperwork, but people come in all the time for disability tax credits or Ministry of Transportation notes, sick notes. All of these things take tons of time. The average family doctor's appointment is 15 minutes. So with the flexibility in my schedule, I can extend it to 30 minutes if I need. And then a lot of these forms I can sign on my own, and then I'll write under whatever Dr. X. Sometimes I know that a form will not be accepted if my signature is on it. And so I quickly just find them in between patients to have them sign it. So I've already taken off that huge burden, which is the paperwork, which might take several weeks for them to get to. Additionally, where I work Monday to Friday, 9 to 5. So I'm in the office. I'm the primary person that's there every day. If something changes every day in a patient's care, versus a lot of the family doctors I work with are there anywhere from 2 to 3 days. So to make sure they have constant continuity of care, I'm like that person that can communicate if there's an abnormal result, something's critical, if they need to be dealt with. Which is not only helpful for their quality of life, so that when they are at home, they can either focus on their inbox, they can maybe just take a break. They can trust that their patients are being seen by somebody and not just being having to rely on that themselves. And as a result, we're doubling the amount of patients that are being seen, right, as opposed to just a primary clinician. Now, I also match my physician's appointment times. I usually see things in 15 minutes, so that helps the increase the number of patients that are seen, so there's reduced wait times. So that's really how PAs can help.
Yeah, I'm thinking about all the doctors that don't have any PAs, and you're describing all this. Like, the swarm of paperwork is right. So let's bring up the idea of burnout, the physician burnout. So the article cites a study showing that 95% of the physicians working with PAs reported increased patient numbers and improved clinic efficiency. 90% noted that improved quality of care, and 88% reported better personal well-being. They're feeling so much better, taken care of, supported in their clinics. So that's a really high number that value your contribution to primary care. So obviously, the PAs contribute to reducing physician burnout big time.
Yeah,
Absolutely.
we're a huge way to help with reducing. So, not even just in primary care, but when I worked in otolaryngology, I mean, the wait list to see a specialist can be outrageous. I think the number one complaint that a patient will say, well, okay, we've gotten this far, but now you're telling me that I need to see a specialist. Well, how long is that going to take? We have no control over those numbers. I mean, because it's a different office, but I know when I worked there, the wait list was a year, and just by me working there over 6 months, we were able to reduce that wait time by 4 to 6 months instead. So that's huge, right? Because the patient volume that I'm able to help with. And in terms of burnout, I mean, it's useful for a physician to not have to do every single thing. I mean, some of the messages that get sent or the things that patients want communicated right then and there, they're not always urgent. But it can be very overwhelming when you walk into an office. Not only are you fully booked with patients, but then somebody had an appointment yesterday and then they forgot to ask this one question. And so
Yes.
I can easily fit that into my schedule to help reduce that burden. Sometimes physicians will tell me, I know you didn't see this appointment, or sorry, this person, Portia, but it just came back as a really abnormal result. Can you please call them today if they have any other questions, and we'll figure it out. But those are the ways that I can support them where they're aware of the result. It's just where's the time in the day to go over that. And because I'm competent, I've been doing this for several years. I mean, there's not a lot of results that phase me or I'm a little bit confused what to do. So it helps a lot when you have somebody that you trust to communicate those results with their patients. I also sometimes provide care that some of my physicians aren't even comfortable with. So some of them don't insert IUDs. I know in the clinic I used to work at, this was often a barrier for women. They would have to wait until they would get a referral to a specialist. Now that could be several months. But now I can just book that on my schedule. If you want it, we talk about it, and the next week I can put it in.
Oh, that's great. Yeah, that's super handy. Well, that's great. Okay, so to wrap up, Portia, what do you think is the most important thing for our listeners to understand about how PAs can help solve the primary care crisis?
I think the number one thing is that don't judge our title. When people hear the word physician assistant, they often think medical secretary, and that is just not at all what our role is. I mean, we are trained clinicians. We're here to help. We are an extension, really, of your family doctor and your healthcare team. The way that we're here to help is that we're going to hopefully get you into the office faster than that's before, where you might have had to wait several weeks to see your family doctor. We work with them, so we're not a replacement for your family doctor. I think people are always afraid, well, I'm never going to see my family doctor again. That's not the case. I mean, they're aware of what's going on at all times, but it's just a way that we can get you in sooner. We can help reduce not only your stress, but also the physician's stress as well.
Absolutely. So it's a great collaboration. So thank you again, Portia, for talking with us. We really appreciate you sharing your insights with us today. So to our listeners, thank you for tuning in to Prescription for Primary Care. We hope this episode has shed light on the crucial role of physician assistant in addressing Canada's primary care challenges. Until next time, I'm Rebecca Ramdahal, wishing you good health and better health care.